Well, on this Tuesday, people all across the country are turning turquoise for a special cause. We're wearing our pins today. Everyone's wearing the color to support the American Lung Association's Lung Force, which is the initiative designed to raise awareness of lung cancer, especially in women.
All right, and joining us now to talk about this is Dr. Keith Mortman. He's the Director of Thoracic Surgery at George Washington University Hospital. Thanks for coming in and talking with us about this.
Thank you.
What we can't figure out, because we've been looking through the statistics, okay? Lung cancer actually is the #1 cancer killer among women. How is that, and why is that?
Yeah, so lung cancer is the #1 cancer killer, both in men and women. And unfortunately, more women in the U.S. succumb to lung cancer every year than breast cancer, uterine cancer, ovarian cancer combined, actually.
Wow.
Really? Yes. I think a lot of folks would be surprised to learn that.
So it's interesting. That's the irony of it. Despite being the #1 cancer killer, it's still a very underappreciated and under-recognized entity.
And do we know why that is? Is there a stigma attached to lung cancer?
There is some stigma associated with it, and I think we're getting better as the years go by. The fact of the matter is about 10 to 15% of the lung cancer patients that we see have never smoked before, and most of those people are women.
Now, we know one. As a matter of fact, our very good friend Greta Cruz had a case of that here where she didn't smoke, and she developed that particular kind of cancer. Tell me about the deadliness of this disease, because I think once people understand what we're dealing with here, they'll get why we all should be wearing turquoise.
Right, exactly. And in the world of cancer, the statistic that we measure is 5-year survival. So how many patients are alive 5 years after diagnosis or after treatment? And unfortunately, with lung cancer, when you look at all comers, that number is about 15%. Wow. Only 15% of people are alive at 5 years after diagnosis or treatment. Now, when you break that down and you look at people who are diagnosed with early stage lung cancer, stage 1 lung cancer, when we find it early before symptoms occur, their survival statistics are much better.
Well, you know what? I have to ask you about that, because we talk about this all the time as well. Guys are so much worse about going to the doctor than women are. Women go to the doctor all the time. Shouldn't they, or can they, find out if they've got it a lot earlier than say, most men would in average cases?
Right, so there's a study that came out just a couple of years ago that looked at low-dose CAT scans. So for a certain subgroup of patients who are at risk for the disease, having an annual CT screening examination. So we know that that's actually going to move the needle a little bit on survivability from lung cancer, finding these tumors earlier with this low-dose CT scan.
Well, thank you so much for helping to raise awareness on this, especially for women, because as you said, we hear so much about breast cancer and some of the other cancers that women face, and not this one as much, so it's really important.
All right, so we'll be turning the town turquoise today. Right? That's it. All right.
Thank you, Doctor.